Welcome to the Wake County Elder Care Channel, brought to you by Tom Arnold and the great folks of Right at Home Wake County. Today's guest is Ashley Beta, Regional Director for Pruitt Health. Today's topic is Pruitt's Home Health Care Services.
Hi everybody, I'm Tom Arnold and I'm the owner and founder of the Wake County Elder Care Channel. And I'm here today with Ashley Beta, who is the Regional Director for Pruitt Health. Welcome, Ashley. Glad to have you here. And we're in this beautiful one-bedroom suite right here in Whitaker Glen and inside the Beltline in Raleigh. It's just an absolutely gorgeous community. And we want to talk a little bit about Pruitt's home health program. Pruitt is known for a lot of things. You do a lot of different things, very large company, but you can kind of touch on some of the overall things that you guys do, and then we'll get into talking about home health.
Sure. Pruitt Health, like you said, is a large privately owned company, predominantly right here in the Southeast. We run between 4 states: North Carolina, South Carolina, Georgia, and now Florida. We're happy to say now that we're in the state of Florida. We do have over right at 100 healthcare centers, assisted living communities, and independent living communities, home health, hospice, home infusion, pharmacy. We have several different consulting service lines. We help with the SOURCE program, and what we call the SOURCE program in Georgia, which is a Medicaid program where we help keep Medicaid recipients in the home instead of in skilled nursing centers. So we work with the state of Georgia on that. We also now have Pruitt Health Premier, which is a Medicare Advantage program for patients that are inside our healthcare centers. So we're very proud now to have that as well.
Excellent.
Just a few things that we do.
I want to touch on home health. A lot of people hear the word home care, home health. They know Right at Home as a home care provider where we go in and provide personal and companion care services. But I want to talk about home health and what you guys do as a home health provider and exactly what that is.
Sure. Home health, and you have to think of it more along the lines of skilled services. So home health, after somebody might be done in a skilled nursing facility, they might still require some skilled needs. No longer that need necessary in a skilled nursing facility, but now they can have that need at home. So they go home on home health, and they go home with some skilled services like physical therapy, occupational therapy, or speech therapy. They might go home with some nursing services. Perhaps they need wound care, IV therapy, medication management, diabetic management, or education for a few days. So they go home on what's called home health services.
And those services are typically covered by their Medicare program.
Or their insurance program.
That they have, their
That's
health
right.
insurance.
And that's a little bit different than home care, and that's a great question, as that often comes up, the difference between home care and home health. Whereas home care is more companion services as they go in and they take care of the patient with companion services and perhaps some ADL services,
Right.
bathing, dressing,
Right.
helping the patient get around their home in and out of chairs, keeping them safe, giving the family some peace of mind knowing that somebody is with them throughout the day, perhaps some light housekeeping or a preparation of a meal, and things like that, which is why we partner with companies like yours.
I need to get you to do a commercial for us. You can explain it better than I can. Great job. But yes, we often partner with home health providers, particularly Pruitt. When people are in the need of those services from a hospital stay, coming home from a hospital, or a rehab environment like perhaps over here at Mayview. But yeah, the two of us work very well together and provide that short-term need for people that have those skilled nursing needs, for example.
That's right.
So, tell me about your home health operation right here in the area in Wake Counties.
We're very proud of our Wake County Home Health. It's actually right here on the campus of Mayview, which is our skilled nursing center, and Whitaker Glen, which is our independent living center. So right here on our campus is where we house our home health agency. We service several counties in the area with all 3 PT, OT, and speech and nursing services. So we can provide a wide variety of services to our clientele. We also provide those services to patients right here in our independent living center And then, of course, we have our own therapy staff that services our healthcare center, which is a little bit separate.
So you not only do skilled nursing, you do physical therapy, occupational therapy, speech therapy, as well as any skilled nursing requirements.
That's correct.
That the patient may have.
That's right.
Excellent. Anything else you want to share with our audience as far as, let's say somebody feels like they're in need of your services, how would they find you? How would they get a hold of you?
Well, of course, anybody can go to PruittHealth.com and get on our website and locate us. That's very simple. But of course, going into the hospital, most everybody knows our name by now, and I hope that they should, but they can ask for Pruitt Health Home Health Services. Same going into any skilled nursing services, just ask for the name. But most simply, if you just get on our website, PruittHealth.com, you can find all of our information right there on our website.
Okay. And you can also go to the Wake County Elder Care channel and go to the home health section, and you'll see Pruitt right up at the top, and just click on that and it'll go right to your website.
We're very excited about that.
Well, thank you, Ashley, for being here today. It's been a pleasure, and you guys have a great organization, do so many great things, and it's a pleasure to partner with you and be part of it.
It's the same, Tom. Thank you.
You're welcome.